Good evening, everybody, and welcome to the webinar Vet. Tonight's session on making cats' golden years good. My name is Bruce Stevenson, and I have the honor and privilege of chairing tonight's session. So tonight's presenter is Dr. Sheilah Robertson. She graduated from the University of Glasgow in Scotland. Following a time in private practice and a surgery internship, she undertook specialized training in anesthesia and completed her PhD at the University of Bristol. She is board certified in anesthesia and in animal welfare for respectively the American and the European colleges, and holds a certificate in small animal acupuncture. In 2014, Sheilah completed her graduate certificate in shelter medicine at the University of Florida. In 2019, she received her certification as a traditional Chinese veterinary medicine, palliative and end-of-life practitioner by the Chi Institute of Chinese Medicine. She has published widely on the recognition and alleviation of pain in cats. Currently, Sheilah is the Senior Medical Director of Lap of Love Veterinary Hospice, a large network of veterinarians dedicated to the end-of-life care and in-home euthanasia throughout the USA. Dr. Robertson is also a courtesy professor in the Department of Small Animal Clinical Studies at the University of Florida in Gainesville. So with the proud sponsorship of Feline Friends Academy tonight, Sheilah, welcome to the webinar Vet, and it's over to you.
Well, thank you very much, Bruce, for that introduction. And it's a real honor to get to talk to cat owners, or should I say people that are owned by cats, because I usually speak to the veterinary surgeons, but actually speaking to the people living with the cats who are dealing with some of the senior issues or the geriatric issues of the cats every day. It really helps me understand what you need from us. And although we've called this Making a Cat's Golden Years Good, I'm hoping by the time we're through all of these slides and chit chat and answering questions that maybe we can talk about making those years great. Now, when Carlin contacted me from Feline Friends, a very nice invitation, she gave me quite a shopping list of topics that we could cover for the elderly or older cats. And obviously in this time frame this evening, we're not going to get through all of those, but I am going to hit on the sort of things I think are very important, and also some of the things that she and I talked about as being very difficult topics, which are, you know, knowing when quality of life is deteriorating, and then end of life issues. So we will broach those somewhat difficult but very important topics. Some of the things that we are going to think about as people that, you know, cohabit with cats is that there is no doubt, because of the advancements in veterinary medicine and the ability of owners to care well for cats and being prepared to do preventative medicine, cats are definitely living longer than they used to. And certainly in the United States, it's estimated that of all the patients that are on our clinic files, about 40 to 50% of them are actually in the senior or geriatric bracket. So we actually see a lot more senior and geriatric patients than we see kittens or puppies. So that's an important thing to think about. But equally, what we have to make sure or ask ourselves all the time is, are they enjoying their longer lives? So what we're really aiming for is longer lives with us that we can share with them, but that longer life has to be a very good life. So we are looking for quantity, but much more so quality of these extra months or years we may have with our cats now. The other thing is that without a doubt, we all know, and those of you that have had older cats know, that chronic disease or chronic diseases increase with age. So as our cats age, they do develop some pretty classic old age diseases. And cats are pretty notorious for having more than one problem as they become older. So, I really do believe that age is not a disease in itself, but it is an unavoidable process. I mean, it's part of life. You know, there's two things that are very certain about life for us and the animals we share our lives with, and that is birth, everything in the middle, and then death. And we can't and probably shouldn't try, and nothing we can do to prevent that whole biological process from cradle to grave. But we can make the time that we have here on Earth really, really good for us and our pets if we think about it carefully. So I have been, as I said, owned by a lot of cats over the years. I've had rescues, I've had fosters, I've had stray cats show up. And so here's one of my all-time favorites. This is Kermit. And here's a picture of him at 3 months of age where he was, spunky, robust. I could, took him in to have his neuter done. And he looks great. But here he is when he's 15 years old. And he did age, he seemed to age very suddenly. And those of you that have had skinny old cats can probably guess that he has some kidney disease, he's got some arthritis, he may have some other problems, and he doesn't look quite like he did when he was 3 months of age. So we're going to talk about, what is a geriatric cat. And in humans, what I've done really with my new position, doing end-of-life care very, very specifically, and also doing euthanasia, I have started to read a lot about the human geriatric literature. And what they have done is not just define a geriatric as a person that has reached a certain age. And I think that's a good idea. They actually call someone a geriatric if they meet certain criteria. And the criteria really describes someone who is frail. And so I think we can apply that to our older pets. So if a human has some weakness, some unintended weight loss, they fatigue easily, and they slow down as far as mobility, if they meet 3 of these criteria, they're considered a geriatric. And when I think about the older cats that I've dealt with, I think this fits very, very well. Not just their age, but if they have 3 or 4 of these syndromes. So what about wellness checks? Well, you all know that it's very important to take your cat to the veterinary surgeon for wellness checks, because obviously the sooner we know something's wrong or pick up something, the easier it is to treat it. So prevention is always better than a cure, and that's why we recommend certain vaccines, certain blood checks, and so on. But we also know that as cats get older, that should happen more often, as often as twice a year, even when we think things are good. But I also understand myself that can be quite stressful for you and for them to, pack them up, take them on that journey, and take them to the clinic. So wellness checks, we always think of them as being done at the clinic or at the veterinary practice. But I always say that we need to involve owners much more as part of our wellness team, as part of the veterinary team, because you know your cat better than anybody else. And there's things that you can do at home. So if we look at what a wellness check would look like at a clinic and what you can do at home, that would really sort of help us detecting if something is going wrong. At the vet, what they're going to do is weigh your cat. That's one of the first things they often do. But you can do that at home. And I would highly recommend that you weigh elderly cats on a frequent basis because, they can look fluffy. You may not be touching them enough. And, weight loss is often, telling us that something's not right. Your veterinarian will do a body condition score. So they have a certain chart and they mark down, the body score. You can actually track how your cat looks by taking frequent photographs. And that's a good idea to take them and date them, because then you can look back and see if things are changing, you know, how skinny they look or how their face has changed, because cats will express pain through their facial expressions and so on. We look at muscle condition score because as animals age and as we age, we lose muscle mass. That's a condition called sarcopenia. And we cannot stop this, but we can certainly slow it down with exercise. And there are some tricks to getting cats to exercise, and very, very good nutrition and high quality protein. So you should do frequent hands-on your cat, like feeling them, you know, do the bones feel more prominent than, you know, last week or the month before? And then obviously what you're also doing at that point is looking for lumps and bumps that you might want your veterinary surgeon to look at. Obviously, when you bring them to us, we do a physical exam, you know, hands all over, just like you could easily do, but we listen to the heart and lungs, and then we might want to run blood and urine tests. But you can do things like keep an eye on their water consumption, because cats with kidney disease will start drinking a lot. Cats that develop diabetes will start drinking a lot. And then the other thing is to watch their appetite. So, you know, measuring or looking at how much food goes out each day, how much is consumed. That can be a challenge if you own more than one cat. But these are things that will alert you to problems early, which is what we want you to do and come and talk to us. So for example, here is a sort of series of photographs that we can see how this little black kitty, another black kitty, I'm a big fan of black cats. So here is one of his kitten photographs as an adult, and then you can see quite markedly how, you know, even the color of his eyes have changed, his, you know, how he's holding himself, and his fur coat has changed. And when you're living with them every day, you maybe don't notice, but if you flip through photographs, you can see this change. And actually on him, one of the things I noticed was that he doesn't, when he gets older, on the very right there, it looks like he needs some help with his nails being trimmed, because he's maybe not using his scratching post as much. So that's just something very observant that, you know, you can pick up, or a veterinary surgeon looking at pictures can pick up. You may even be able to text them a picture and ask, you know, is this a problem, without actually having to go for a visit. So one of the things that you do need to be very good at is finding the veterinary clinic that suits you and suits your cat. And as you probably all know, there is a big initiative to have cat-friendly clinics, because you know, cats don't like being mixed in with dogs, or if it's a mixed clinic, they should be, you know, held separately. You know, they don't need to be listening and looking at barking dogs. So certainly catfriendlyclinic.org, they have a great website where you can type in your location, find out if there's a cat-friendly clinic near you, and you might want to call or interview them to see if it is the right practice for you. But certainly there's a lot of practices that know very well that cats are not small dogs and will treat your cat very, very well. Decreasing the stress of vet visits. I read an article not very long ago saying that about 2 weeks prior to a cat vet appointment, the owners start getting very anxious. So this is not just about the cat getting anxious about a visit. It's the owner thinking about, oh, you know, it's so hard to get my cat in the carrier and that journey, and listening to them, you know, howl, and, you know, they start getting stressed out. So there are things that you can have a checklist. You should ask your vet about sedation of your cat before leaving home. And once they know your cat and they've done a physical exam, there are actually certain drugs that are very safe and easy for you to give to sedate the cat and make it less anxious for the entire visit. If you have a cat, and I've had several of them that do not like the car, or maybe they don't like my driving, not sure, and they get car sick, and that is very unpleasant, but there are certain medications that your vet can give you to prevent your cat, feeling very nauseous or getting car sick. The correct carrier, and I'll show you the carrier that we would love you all to have to make our life easier and your life easier. And then we'll talk a little bit about carrier training so that they don't think it's a very scary thing and it's novel, and they know that if the carrier comes out of the closet, it means they're going to see the vet. And then other things like pheromones, you probably all have used those, the sprays to decrease stress, and then appropriate food treats. Because even if they're going in for a procedure, there's a lot of times where a very small food treat to give them their, sedation is not a problem, for the vet when you get there, but it helps make the medicine go down easily. And it's not you fighting with your cat to give it something that we know should help. So International Cat Care, I certainly think they have some wonderful resources for you. So iCat Care, they have a very, very good section on their website about taking your cat to the vet. And one of the things that they talk about is the right type of carrier. And this one pictured here is the type of carrier that I like cats to arrive in, because it has these clip together top. So I can easily pop that top off and look at your cat and pick them up easily, or just leave them in the carrier and do the exam. They don't need to leave the carrier. This is much better than the nuts and bolts and all sorts of things that are tied together, where I would have to get the cat out the front, and that can be a challenge. The other thing that you can do is to make sure that a blanket that the cat has been sleeping on and rubbing on, that he or she's already marked, is what's in the carrier. So it's very familiar and comforting. And then you can spray that with pheromones. And one that you probably know about is Feline. But if you do use that spray, if you spray the carrier or wipe the carrier or spray the blankets, you don't want to put the cat in there for at least 15 to 20 minutes, because there is some alcohol in those sprays and wipes that needs to evaporate. So make sure and plan ahead with that. And then the other thing is to decrease visual stimulation. And so you would then cover your carrier with a towel. And that would be, just takes away all the outside stimulus for the cat. The other thing is, and I was very guilty of doing this, once my cat was, in the carrier, I would just pick it up and move around with the carrier. And we now know that we should probably not do that. So we don't want to just pick it up and carry it. What we want to do is hold it against our chest, hold it firmly so it doesn't rock around, and that it's very secure and not sort of wobbling. If you want to know why, you should always think about life from your cat's point of view. So if you were a cat inside a carrier, and what I've done is I filmed or put my video camera inside a cat carrier and picked it up as if I was leaving to go and put the carrier in my car. And when you watch this video, this is the door just got shut and the cat inside sees the other cat, and I've just forgotten where my keys are, and I'm looking for my car keys, and I'm looking around, and then I'm like, okay, we can kind of go. And if you that was just like a few seconds. And so you can imagine if you do that with your cat carrier, and then you do that getting out of the car and walking into the surgery, no wonder cats are upset or feel sick, because that's not any good. So I keep my carriers out. I make them into like cat furniture. They should always be out in the home. Never kept in the closet, only for the day that they go to see the vet. I put them in their favorite place. I treat them with pheromones on a regular basis. And what I do is, with the yummiest treat that my cats like, I'll toss them into the carrier and let them eat a treat, and then reward them for going inside. They get another treat. They get verbal, they get a verbal, good boy, good girl. Or if they're a cat that loves to be petted, they get a reward for going inside the carrier. And then that makes the day that they're going on their trip to the surgery a whole lot easier for you and makes it not so scary for them. So there are a lot of chronic diseases that cats get, and a lot of cats have more than one problem. And what I've decided to do is just pick out the top ones that I think we overlook. And probably that is actually arthritis in cats. We're really realizing how common that is. And I think in the past we've just gone, well, this is like old cats, they're slowing down, but not thinking they could be painful and have arthritis. Chronic kidney disease, very common. Cognitive dysfunction, so like Alzheimer's in humans, actually the changes in a cat's brain are very similar to what happens in humans with brain aging. And then dental disease. These are some of the top ones that we'll touch on. So early detection is always what we're aiming for, knowing that something isn't quite right. And when we talk about arthritis, is this an older cat who, would get slower and not act like a kitten, but is the slowing down or change in behavior, could it be linked to pain? And that's something that your vet can help you with. So we want early detection. Now, what we now know, which we didn't know 15 or 20 years ago, is that if we x-ray all cats, if we just take any cat that comes through our clinic door and we take an x-ray of it, between 60 and 90% of them will have a change in one of their joints that is very, very highly suggestive that they do have arthritis. Now, not all of those joints that look arthritic necessarily are painful, but certainly about 50% of the cats that have these changes do have pain in these joints, and that pain impairs their ability to jump, to run, to hunt, to do lots of things. So this is a very common disease. Now, certainly it is more common in cats from 10 years and up, but it is also seen in cats younger than 5. I've certainly seen this disease, but more common in older pets. Now, the sad thing is, because it's difficult to detect, because remember, cats are great at hiding things, what we now know from surveys is only about 7% of these cats actually receive treatment for their arthritis. And that's something that we want to work on and we want to fix. So how would you know if your cat has arthritis? And there are a lot of websites. This is one from a drug company where they have lots of diagrams and pictures of how a healthy cat jumps up, but how a cat with a joint disease or arthritis would jump up onto a table, how they jump down, how they run. So what I'm going to do is give you another resource in the next slide of a very, very good video. It's about 4 minutes long. We're not going to watch it, but I do suggest that you watch it. And it's narrated by Dr. Duncan Lascelles, who is originally from the UK and probably one of the leaders in arthritis research in cats in the world. So it's at a website called painfreecats.org, and it's a very informative video. It tells you all the things that you should look at to know whether or not your cat has chronic pain. It talks about the jumping up, jumping down, which I'll go over, and it talks about how common this is and that even young cats may have this disease. So let's look at this picture, and this is my kitchen in America, but you can see I'm still pretty British. Got my tea towel there, my Union Jack tea towel, and there's a cat. There's one of my cats, that's Eddie, and clearly he got up there somehow. So he would not appear to have a problem getting up onto things. But here's one of my other cats, and the sun is nearly always shining in Florida, and he has a lovely perch up there to sit in the sun. But I noticed that he wasn't going up there anymore. He was just, this is Josh, and he is just sitting on the floor. And I suspected, maybe he can't jump up onto his cat tree. Maybe there is a problem. And it turned out that yes, he did have arthritis and couldn't jump up because it hurt him to jump up there, and he wasn't as agile as he used to be. Other things, when I go into homes, because I do a lot of home visit, I look for clues. Now this is Lou, one of my favorite patients. He's 22 years old, and I go and do checkups on him, and I can find clues. So the owners have a leather couch, and Lou loves to spend most of his life on the back of the couch. But when I looked carefully at the couch, I can see that he's probably having to use his claws and climb up to get onto the back of the couch. And you can see under the magnifying glass there, there's big clues. The rest of the couch was completely fine. This is his favorite spot, but he can't jump up on that. Other clues are muscle loss. And now cats do lose muscle mass as they age, but there's some specific patterns when they have arthritis. So all these cats that I've lined up in this photo array have arthritis in their knees or in their hips. So that means that they tend to put more weight onto their front legs, and the muscle in the back wastes away. So you can see these very narrow hips, and that's a clue to me. If I was looking down at this cat, why has that symmetry changed? And I would be concerned about arthritis in the hind limbs. Grooming, as all of you who watch your cats groom, you know that they do like Houdini moves in order to get nice and clean. And here they, I don't know how they manage these contortions, but they do. But imagine if you have arthritis of your hips or your spine, then you can't groom as well. And this is why some of the arthritic cats look like this cat in the picture, because they can't turn because it hurts, or they are, stiff. They can't groom as well. So that's a clue to me. And then that's something that we certainly can improve with pain management, but this is something we would ask you to help them groom, because they do like to be all nice and groomed. Toileting, I've certainly had owners come with their cat and tell me that it has inappropriate elimination. They say he or she has started either urinating or defecating outside the litter box, and this has never been a problem before. Now often that could be stress or some behavioral problem, but one of the first things I do is check that the cat can actually access the litter box and it's not refusing to go in there because it's painful to climb in. The other thing is, in this photograph, this is one of my cats who did have hip arthritis. We've made a cut in the front of the, basically we just bought a big plastic container so he can get in easily, but he can't position himself like a normal cat. And he would urinate over onto the floor if we had a normal, short, very normal, not very high-sided litter box. So I like these litter boxes with easy entry, but with high walls for the cats that may have problems with positioning when they have arthritis. But what we learn a lot about is videos that you take at home. Because when you take your cat into the veterinary clinic and you open the door and we all encourage them with a treat to come out, they don't act like they do at home. They're not walking around. In the clinic exam room, there aren't stairs, and you may have stairs at home. So they're not going to, just walk around and show us what's wrong. So I have owners take videos at home. Everybody's got a smartphone. And I tell them, please take a video of them walking around. How do they jump up and down? If they go up and down stairs, just make a quick video so I can see what's going on. And from that, I can learn a lot about if there's a problem and where the problem might be. And that, gives me, good information to start my workup on your cat. So here is Lou, our 22-year-old cat. And I go to his home because that's what the owners prefer. But if he came to my clinic, this information in the video that you're going to see is very, very helpful for me because I can tell where his problems are. So let's look at Lou. So you can see that he is not walking like a normal young cat, although he can get up speed when he wants to. but I can tell from the way his legs are positioned and so on that he has a problem in his hips and in his knees. So I'm going to focus on that because not all cats, or a lot of cats, don't like a long physical exam. So I already know a lot about Lou from a very quick video clip. The other thing is I might ask an owner to take a picture of the cat jumping up and down. So normal cats just leap off things. They go out, they leap down, no hesitation. But a cat with arthritis will look for a way that makes it easier to get down. They'll look for, a chair or a box or something to get down from a table, and also to get up. They can't leap all the way up, so they'll look for something to help them get to that high perch that they like to look around and see who is in the home and what's going on. It's where they want to be because it's safe. So first of all, we'll show you a video from an owner who had multiple cats, and we'll show you what her normal cats, how they get up and down. And so in this kitchen, they have the option of using the chair to get up because an older cat with arthritis might choose to use that to get up and down. But let's see what her normal cats do. And it would appear that the normal cat went straight up. He's a young, pretty healthy, and she threw a treat there. He jumped straight down. He's hoping there's another one up there. So you can see, oh, and then someone else is interested. But you can see how easy it is for that cat to just leap up and down. So let's look at what a cat that has a problem does. So this is a little kitty called Spice. She was a patient of mine, and let's see what she does. She's sitting currently on the computer, staying warm. Remember, cats love places that it's warm. They're not really trying to interrupt our work. Computers are nice and warm, and as they get older, they really seek out warm places. So let's look at Spice sitting on the computer, and then there's something happening and she needs to move. So there's a chair there. She's actually in an office there, and she used the chair to get down, and now she's walking towards the door. And you can see how she holds her back legs under her. You can also see how her hair coat isn't sleek and shiny. And you can also see, even from that still picture now, that she's got muscle wastage in her thighs. So I already know a lot about her problem. There's another maneuver called the reach and slide that you should look for very carefully. And so I'm going to show this in normal, at normal speed, and then replay it in slow motion. So as we saw, normal cats just jump off things, but look at what a cat that is worried about hurting his front paws or his elbows or his shoulders will do to get off a bed. So, obviously we've got the bright eyes because of the camera, and we saw him. Now look at, if we do it in slow motion, what he's going to do is he's going to slide down as far as he can, sliding to get as close to the floor as he can before he lands, and that breaks the fall. So this reach and slide is an indicator that they may be painful in their front legs. And obviously I'm not going to talk about how we treat arthritis, but you should know that now, in this day and age, we have a lot of things in our toolbox that are specifically designed to help cats with arthritis. We have a lot of options to alleviate their pain. And then you are part of that medical team. You'll be helping to give the medication, and you may be asked to do other therapies on your cat to help them through this disease, which is not curable. We can certainly make them feel better, but it's not a disease that can be completely cured, as you know it can't in humans. But there's something very important that we need to think about untreated pain and anxiety in cats in a home that's not enriched, or where there's some friction between cats or other animals in the home. So a lot of anxiety exacerbates pain. It makes pain worse. And we know from humans, when have chronic pain for a long period of time, it does actually accelerate your cognitive dysfunction. your brain deteriorates more quickly. So we know that similar things happen in animals. So there's things that we can do. We can introduce cognitive therapies. And I'll show you one of those that I use on my cats and recommend to patients. We want to decrease stress and anxiety. And we need to be careful about what social interactions these elderly cats are having. Some is appropriate, some's not appropriate, and they don't want it. And then exercise, encouraging cats to exercise to help their joints and also help their mood. All of you that exercise know that you feel better after exercise. So one of the things that's important is quiet time. So this is time just you and your older cat, sitting on your lap, doing computer work, knitting, doing something. So quiet time with you, bonding, is very, very important. Let's look at this cat. This is a cat called Wallace, and this is a video of Wallace and his friends. And we'll talk about, what Wallace really needs after we watch this video. So let's look at Wallace and his friends. So he lives with a lot of boisterous dogs, very happy dogs, but he has mobility issues. And he's not feeling comfortable right now with all of this commotion in the house with all these dogs. And he wants to get up and be safe, but he's only forced to go up there when another dog comes very close to him. And, that isn't ideal. So what Wallace really needs is our safe places. And all cats, and in particular older cats, they need safe places where they can go and rest. So, for example, on the left, an easy access to a nice, soft, padded bed in a window. Cat flaps are not just for going in and out of doors. A lot of people in the US don't actually let their cats out, but that doesn't mean to say a cat flap isn't important. I have one for my cats because I also have a dog where they can actually go into a closet and the dog can't go in after them. But when you choose a cat flap to let them into their safe place, it needs to be at the right height, not difficult to get through. It shouldn't be a heavy flap that they have to push, because if they have arthritis, they won't want to do that. So your veterinary surgeon could help you choose the correct flap. If there's multiple cats, you can actually get them collar operated, where the right cat walks up, the door opens, and the other cats can't get in. Or lots of places, like on the right there, cat caves, nice safe places to hide. Food puzzles. This is something that we encourage to keep their brain functioning well. So it also makes them act like cats in the wild. They have to look for their food. They need to not eat sort of during the day when they find their food. This is much more natural. So this is one of my cats here, and this is one of the food puzzles that I use. There's lots to choose from. I mean, just go on the internet and there's lots to choose from. But he has to figure out and use his paws to get his treats out. He's bonding actually with my husband there, who's doing the crossword puzzle. And then when he's had enough, he jumps down on the chair that's been left there for him to get down. But that engages their brain, keeps them occupied. It's good enrichment. What about activities of daily living? If you had an elderly parent, they would have someone come into the home and go around the home and say, what do you need to make this home safe and easy for you to live in? And we can do that for cats. It's very easy to look at videos of a home and come up with some ideas. So as we've said, older cats can't jump up onto their favorite place. So here, this owner has just put down a little rubber, I guess it's just like a little step. It's not slippery, so they can get up onto the console and then up onto a nice soft bed in the windowsill. And on the right, another cat who they've just put a little stool there so he can hop up and sit in the windowsill. Lots of good ideas. And then massage and grooming, very, very good things to do with all of your cats. And as they get older, what we find is that they don't groom as well. So you can do therapeutic cat massage. And I like the little rubber ones here. Here's a little cat who has a lot of problems, including only having one eye. But doing this, it makes his coat all nice. You can see how he's loving to stretch. He's enjoying it. And we do know that grooming actually gets cats to release endorphins. It releases a lot of very good chemicals that make them feel good, that actually help with pain. I mean, who doesn't like a good massage? So that's something that you can do to help your cat feel better. Raised feeding stations. You can buy a lot of very fancy raised feed bowls for your cats, so they don't have to flex their elbows, or if they have a sore neck, to reach down to get their food. Doesn't have to be fancy. Here's something I did for one of my cats. Just built him a little food bowl there. Then we've talked about indoor toileting. If your cat is toileting indoors, this is the sort of thing I would choose for a cat with arthritis. So first, we have a non-slip mat because you don't want them on a very shiny surface. We want low entry, and these people, like I did, have just cut out a hole to make it easy entry. And then a high back, because they won't urinate all over the wall if they don't crouch down. But just in case they do, then you can have paint the back wall with waterproof paint, which these people have done, and then they put down some towels. One of the things Carlin mentioned is that a lot of you are terrified about anesthesia in your older cat. And I understand that, but nowadays we have a lot of safe anesthetics, and we have people well trained in anesthesia. And we also now know that anesthesia starts at home and ends at home. So just as getting a sedative for going for a visit, often cats can be sedated at home, so the whole process is less traumatic for them. So these are guidelines that are available for you to read. There's guidelines about what to expect on the day of surgery if your cat needs an anesthetic. And probably the most common reason that I anesthetize cats is to do dental cleanings, which is very, very important to keep them healthy. Their dental disease is quite painful, can cause inflammation and disease, or they may need an ultrasound to work something up. And some of that can be done just under sedation. So they don't always need to be under general anesthesia. So talk to your veterinary surgeon about all the pros and cons, what to expect, who's going to be doing the anesthesia, how they're monitoring. You can ask a lot of questions that they will answer. And then because we're talking about older cats, palliative care is something that we do need to talk about. And palliative care is a term that's not well understood. It's basically a type of care that we offer people or animals, that it can be at any age or stage of illness, but it's focused on improving quality of life. So it's managing symptoms of a disease that they have. And that may be a curable or a chronic life-threatening disease. But we're providing this along with other medical treatments. And in cats that have chronic kidney disease and they maybe have arthritis, we're managing symptoms. So pain with arthritis, their mobility, we're doing helping them in the home. Anxiety, we have medicine or things that we can do, separating cats. Nausea and vomiting, keeping them clean. This is what we're focused on. And this is very different from what we would maybe consider veterinary hospice. Now, people are very confused about what hospice is, even in people. Hospice is not a place that animals or people go when they don't have any hope of being cured. They're just going to be kept comfortable. It's a philosophy of care. And what is veterinary hospice? The way I look at it is, it's a chance for the pet to smell the roses and for you as the owner to witness that. And this happens when, we have decided to stop treatment. There's not a treatment option, but we can still have time with our pet before we need to make a decision about euthanasia. So it's all about, it's not about living longer, but living better during the end of life. That's what it's all about. It's not just prolonging life, it's making what time we have good. So hospice, again, we're managing symptoms, we are focused on quality of life, and we're looking for comfort, understanding that we no longer can offer a cure for their disease. And another huge part of hospice care is the veterinary team supporting the owner and family. So that's you and your family going through this difficult phase with your cat. One of the things I certainly see a lot of is that people are very, they're just so focused on helping their cat. They're asking for all sorts of medication, treatments. They want to do a lot. But I think this quote from one of my vets that does end-of-life care is talking to an owner about how much they love Edgar, the cat, but his life should be peaceful, not running away every time a pill comes out or he has to have another treatment. So we need to be very careful about how many medications we decide to give, because we don't want our cat to become, doesn't like us anymore. Like as soon as they see us, they run because they know what's coming. And that's something that must be avoided. And that happens when we try to force feed cats that don't want to eat. So Laugh of Love, my company that I work for, and this is our website. We have a lot of brochures that you can click on. You've got the website here. Your own veterinary surgeon probably has a lot of information that they can give you. But if you went to our website and you wanted to know about anxiety in cats, you can download this leaflet that talks about the causes, what you can do, and we have a lot of information there. Because at a vet visit, there's so much information that, it kind of goes over your head. So you should have resources to look at and read at your leisure and to think about, and then to come up with questions. And then quality of life, as I've emphasized, this is what it's all about, quality of life. So again, on our website, we have, tools to help you determine quality of life. And then the big question, how will I know it's time? And obviously, you know that we're talking about time to say goodbye. And so we have a lot of tools on that website. And really, quality of life is all about the things that we would enjoy as we get older and have chronic disease. Emotional well-being. Are we secure? We're not anxious. We still have good bond with our caregivers. We're comfortable, but we have some vitality, and we have time and the energy to do some things that we like to do. And it's the same for cats. And when cat owners were asked, what makes your cat happy? It was very, very interesting to hear what they said. So 40% of things that owners know make cats happy involve, good mobility. But 60% of things that cats do are inactive, doing nothing items. 60% of things that cats do make them happy. And what do I mean by that? So 80% of the time, cats are not doing anything that require, being active. It's sleeping in the sun or on the favorite couch, right? So we can help them enjoy life. And only 20% of the time are they engaged in very active activities. So that's good to know. And this is just an example of a pet quality of life scale and a daily diary that we ask our owners to do. And it's got some, numbers that you can add up, things like their favorite things. If they no longer are interested in their favorite things, that's a big warning sign that they're not enjoying their old lifestyle. And then we do encourage you to do this on a, as a diary, so you can look at what's going up and down. So this is just an example of notes that you and your family might make at the end of the day. Did Molly have a good day, bad day, an in-between day? And you keep this diary so you can track what's happening. And then a note on nutrition. and hydration, what the reality is. People are very focused on wanting their cat towards the end of life to eat. And there are good reasons a cat might not want to eat, and they may feel nauseous. There's a lot of things your veterinary surgeon can do to help with that. But the reality is that at the end of life, this is an extremely good quote, food and water are for the living. The body won't eat or drink for a future it knows it doesn't have. And I learned that from a human hospice person. And so at some point, this may happen to your pet. And so remember this phrase, when you've tried all the appetite stimulants and we don't want to force feed them, this may be the stage that your cat is at. They know the body knows there isn't a future, and that's why they don't want to eat and drink. The other thing is the end of life, the very last appointment. And that is, I want to just go through a little phrase. So life is meaningful because it is a story. Both a story and a life depend crucially on how it ends. In stories, endings matter. So this is talking about how a life ends. It's very, very important. And this came, again, from a human surgeon, actually, who deals with end-of-life issues, Atal Gawande, in his book called Being Mortal. So the ending does matter, but it can be very, very sad. And I call it the last appointment, but it doesn't need to be the worst appointment that you or your cat ever have if you plan well and have a very, very good veterinary team to support. So one of the things is I understand about anticipatory grief. If you know your cat is coming to the end of its life, you anticipate that, and it's very sad. But on the other hand, if they have a disease that is serious and you keep on hanging on, you should ask your veterinarian, what happens if I wait too long? What could the end look like? And it could be you rushing to the emergency room at 2 in the morning, and that's not what you want. You want to make a plan to have a peaceful, quiet, at your own pace, and a day where your cat is feeling actually probably pretty good to say goodbye. So anticipatory grief is real, and you should not be at all embarrassed about this. These are the emotions that, such as anger, despair, that come up prior to the loss of a pet. And I understand those, and your veterinary team should understand those. But children can be amazing. So this is a picture of a cat that I helped say goodbye to. And this is what the children did. The children gave her a necklace and drew her a drawing. And Adam, age 8, we can learn from children. He told me, I don't want any of my pets to ever feel unloved. It's only sad for us when they go to heaven. It's a happy day for them. So we should listen and learn from children about, what end of life is all about. And other things to think about before that appointment is what memorial items you would like. A paw print, a fur clipping. There's a lot of things that can be done. I like a paw print of all my pets. You may or may not want that. You should also think about what you want to do with your pet after the appointment. So you could have a beautiful, place marker in your garden for Lucy. So lots of things to think about and plan. And when you plan, the whole process goes much better. And just to end on this slide, this is one of my favorite tombstones I have ever found. It's in a town called Dedham, Massachusetts. It's at the Pine Ridge Pet Cemetery, and it's old. It's from 1898. So Dewey didn't live very long. He lived for 12 years. But just read that quote. He was only a cat, in inverted commas, but he was human enough to be a great comfort in hours of loneliness and pain. So his owner felt he deserved this gravestone. And then after a loss of a pet, these are real serious emotions, and they can be very unexpected. They can be more or the same as when you lose a family member. So use your support group, call out to them, call for support, write about your pet, journal, put a memorial on Facebook if you feel like it. And the other thing is, if you're really struggling, reach out, because a lot of veterinary clinics have support groups about pet grief and pet loss. And again, we know these are real feelings, and you should not be afraid to express them to your veterinary team. And so just to finish, I want you to know that you have access to our public website at Lap of Love for some of these tools. My email is here if any of you wanted to contact me. And then I also have my own website here, drsheilahrobertson.com. And I just hope that that gave you some good feelings about what we can do for our older pets and how we can face the end of life with them and make it good. So I think, Bruce, I didn't leave much time for questions.
That's okay, Sheilah.
But I think we covered a lot of good information.
Yeah, absolutely. And it was absolutely riveting. Your explanations and the step-by-step way of going through and looking at things is absolutely fabulous. So thank you very much for your time, and thank you for sharing with us tonight. Also, a very big thank you to our sponsors, Feline Friends Academy, for their sponsorship tonight, which allows us to bring these webinars to you to share this fabulous insight that Sheilah's talking about. I did quite enjoy, Sheilah, the camera in the cat basket. It's something that I don't think many people think about.
Oh yeah, I have a lot of videos where I have I've got one that's on YouTube, and it's called "Taking Scotty to the Vet," and it's what we think is happening. So I videotape, the owner putting the cat in and what they think the journey is like, and then I put the video camera, as if it was the cat, and it's a whole different story.
Yep. Yeah.
So always think about, what you're doing with your cat and how you could make things smoother for your cat.
Yeah. Yeah. And even if you can't have a cat only clinic, there's so many things you can do with barriers and putting them up off the floor and that sort of thing. And, it's just, there's nothing more heartbreaking than seeing a dog owner allowing their dog to sniff a cat and going, no, he loves cats. And then you want to go, yeah, but the cat doesn't love dogs.
Yep. Especially when it's close up through front of his private carrier that is his.
And he can't get away. He can't do anything.
Yeah, he's got no escape. It's a very bad situation, but we don't think about it a lot.
No, that's it. So there are a lot of things, and iCat is a great resource as well.
Oh yeah, fabulous resources.
They do some
there.
Amazing work and some such simple things that one can do just to make general cats' lives better. Sheilah, we haven't had any questions coming through. I think that's because your presentation was so thorough, and you really did cover everything in such great detail and with clarity. So once again, thank you so much for joining us tonight, and we look forward to having you back on the Webinar Vet again in the future.
Okay. Thank you. It was an honor. And, people do know that they can, email me if they want, and the resources are, if they rewatch the podcast, or they can get that information if they missed it first time through.
We've recorded all of this, and it will be up on the website in a day or two, so folks can then access it and watch it again and everything else. So once again, to our sponsors, Feline Friends Academy, thank you so much. And to everybody who attended tonight, thank you for your time. And from myself, Bruce Stevenson, it's good night.
Good night from the US.